This is Dr. Adam Goldstein. I'm a family physician and the medical director of the University of North Carolina's Department of Family Medicine Worksite Wellness Program. We do a lot of work with the local town and surrounding areas around trying to increase COVID vaccinations and improve overall health. One of the things I want to do is give a brief update on what's happening in North Carolina and our community, as well as booster shots, as well as to continue to encourage people to get vaccinated. The good news is that at the beginning of October, rates started coming down finally. And that's good news, but there's still thousands of people hospitalized. There's people dying every single day, and new cases are still way too high. We've already seen over 10,000 deaths in North Carolina, over 700,000 deaths in the United States, and over 5 million globally. There is a great news, and that is vaccines are highly effective. They're highly effective at preventing infections. They're highly effective at, if you get a breakthrough case, by having a not a severe case, preventing hospitalization and ultimately preventing death. While they're not perfect, we've seen in state after state, community after community, that those who are unvaccinated bear the brunt of almost all of the severity of COVID, and those who are vaccinated are actually protected. We know the vaccines are incredibly safe as well as effective. As a matter of fact, the myths that are out there don't even have anything to go on because of the safety and effectiveness record. I heard a myth the other day in clinic from a patient who said, well, their brother got COVID after got the vaccination, so the vaccination actually causes COVID. That is completely false. Some breakthrough infections can occur, but again, the great majority of these infections are coming from people who are unvaccinated. The exceptions, the medical exceptions, are only if you've had a severe allergic reaction to the vaccine itself or to a component of the vaccine. There's virtually no other medical exception. Your disease status really is not an exception for any indication. And the safety record is such that less than 1 out of 1,000,000 people who get the vaccine have a serious allergic reaction. So if we know that the myths are false, we know that the safety and effectiveness is high, why aren't more people getting vaccinated? Well, the answer is more people are getting vaccinated. Over 65% of adults in North Carolina have received a COVID vaccination, both doses, and over 69% of the adults have received at least one vaccination. That's what's helping drive down rates in our state and around states around the country. We know masks are still important. They will still be important today, tomorrow, next year. But on the other hand, those who are vaccinated, those who are getting their booster vaccinations, will be able to live their lives with a lot more safety, a lot more comfort, knowing that they're protecting themselves and they're protecting their loved ones. Booster shots are just coming out. Healthcare providers, those with immunosuppression are prioritized, but for whatever vaccine you've had, you will probably within a very short time, if not already, be able to get your booster shots. And booster shots will also save lives. I've received my booster shot. I put out a little video saying it is as easy as 1, 2, 3. And you know what? Knowing that I'm doing things that help me, help my patients, help my loved ones, that's what motivates me to continue to do the things that I know will help us all get back to be with our friends, to be with our families, to be out in public, doing the things that we like, but doing them in a way that prevents infections. So I'm going to encourage you, if you haven't gotten your vaccine, what will it take to get you to consider it? What will it take for you to get it? Let's get it today. Let's get it the next time you're in the doctor's office. Let's go to the pharmacy. It's easy. You will not be regretting what you've done for yourself and your families. This is Dr. Adam Goldstein, the UNC Department of Family Medicine. I wish you a good, safe day.